Hello, all. Welcome to Lunch Break with Bill Wagner. It's good to see you all today. Today, we are reaching the apex of our small business discussion, especially small businesses in healthcare. And I want to go through this with you. We got a lot of information to cover, and I'm sure you're going to love this presentation. Uh, First off, the small business revolution. If you look at large companies today, they have so much red tape, bureaucracy, layers, silos, because they're so large. They don't intentionally create ways to do business slowly. It's just the size, complexity, and the bureaucracy of that business that automatically generates it. When you launch a new product or a new innovation, you have to go through so many departments, so many managers, so much approval, and everybody's got their own process flow and they're overburdened with work. And so it just takes time and is slow because the company has so many irons and so many fires. They're not just looking at one product, they're looking at 100 products to innovate on and decide on, and they're just not geared to handle that. And that's the normal thing with a large company. Uh, Large companies also tend to be risk adverse, and you would think these large companies with all this income would not be risk adverse, but they are. People's jobs, for lack of a better word, are dependent on the effectiveness of programs, projects, um, ideation. So they want to be careful. They want to make sure that this thing is going to be a success. And so they tend to look for things that have shown at least an initial success in saving money, providing better quality service, providing a better product to beat out the competition. So, the idea of innovation is behind the times. You even see this in automakers and large tech where everybody's behind the times a little bit compared to smaller companies. Smaller companies, on the other hand, are nimble and flexible. You may only have 5 people working together that are easy to shove in a conference room to go and develop something, to find a need, develop it. And a small company tends to be more laser focused. So a small IT company might be focused on an IT platform of a specific kind that does a specific function. And they're really, really good at it. So they've only got a few irons and a few fires. And that makes their ability to adjust and adapt to the world around them much easier. Plus, 5 people in a room, you don't have a lot of bureaucracy, you don't have a lot of processes, you're all sitting together, you discuss, you haggle, you look up research, you go back to your office, you look up more research, bring it to the 5 people. So your ideation to launch is much faster because you're all there and you're all working on the same thing and there's no distractions at all where you have a pile of work on your desk that you have to get through before you could get to that new idea. Change to the market. And I want you to ask yourself if when you've worked for small and large businesses, and I can answer this too, what is your product development life cycle? I've worked for companies where it was 2, 3 weeks, and I've worked for companies where it's 2, 3 years. It just depends because a large company is typically going to be very, very slow, careful, and methodical. A smaller company throws ideas out there. If they stick, great. If they don't, move on to the next. Um, and ask yourself, why does it take so long in one company or the other? And I bet you it's a matter of processes. How many people do you have to ask for permission to go to the next step? How many people do you have to get involved in this? Is it possible to conduct a meeting with that many people on the phone within an hour because you got 6 other things going on? Whereas a small company, 5 or 6 people, get together. This is the idea. Go and make it. Everybody says their piece on it, and then the company is ready to go. Everybody is on the same page, and it's easy to shift to gears to deal with that one idea. That's the difference. A lot of small companies, and this is going to speak to doctor offices mostly. Um, and when you're looking at a doctor's office, it's owned by a doctor or a few doctors, and they all practice out of that office. If they want to change the patient experience from intake, and this goes back to what I was talking before about an innovative digital patient experience. You remove a lot of the labor, you put in touch pads and walk people through it, and that way there's less office staff, but people are still getting in on time, and you're not double booking, and your life is just that much easier. Um, a small doctor's office, a few doctors get together and say, hey, wouldn't this be a cool idea? And the time it takes to launch is the time it takes to buy the stuff and have the company that's selling the stuff come in and install it and walk them through the process. That could take a few weeks. That's not hard. It's easy to do. Um, you're more likely to have ideas that don't work with that, but it doesn't matter. It's the ideas that work and the ideas don't work that kind of balance each other out, and the ideas that work will be incredibly successful and overwrite any cost with the ideas that don't work. If you get bought out by a huge conglomerate of doctor offices that are headquartered and the management is out of another city or another state or another country even, will that stagnate your principles? Now you don't have any control over how your doctor's office actually runs. You don't have any control of where it's located. They might say, you know what, we don't need a doctor office in this town. Your patients can find another doctor office. We're going to move you 3 towns over. Um, Large companies offering health insurance solutions by buying up smaller companies. Yes, there's a really nice price tag they put on that, and it's instant gratification. But if you got into this business, you got into it due to principle. You cannot survive in healthcare without a principle focus on patients, patient care, and everything wonderful about the people you work with. A large corporation doesn't have that kind of focus because there's profit margins, there's investors, there's consultancies, and so on and so forth. And there's so many fingers in that pot, each trying to get their own thing out of it. So your vision might just dry up. They'll take in your company, they'll make it a subsidiary, and then they can change that vision entirely. And so you're not going to focus on X, Y, and Z. You're going to focus on A, B, and C. And that's over time. It's not instant. It's 10 years down the road. And so everything you hope to gain from your organization, you'll lose. And that is an awful feeling. It is um it's heartbreaking what it really is. Um, and then there's the principle of your objectives. What do you want to achieve objective wise? What do you want to achieve um, not only objective wise, but as a person, as your legacy? Will that company that buys you have that same legacy, or are they going to want something else? And it really comes down to a question: do you want to be the machine or a cog in the machine? Which one is your choice? Now, I just skipped ahead to this slide. Um, and this is why I want you to see this healthcare revolution of small businesses is going to change the world. Your market's bigger than you think. If you look at a small hospital system in rural Iowa, a small hospital system in rural Iowa has a far bigger reach than its brick and mortar. The brick and mortar way of thinking is dead. You can ship supplies anywhere you want. You can provide virtual services anywhere you want. You can provide hospital at home. Yeah, that's something new. We're going to talk about that next episode. We talked about it a little bit. We're going to dig into more depth of hospital at home. In other words, I don't need to have as many beds. I just need the ICUs, NICUs, and all that stuff, and some rooms for patients that are coming in for quick observation, but otherwise they can go home and get the same services. So all of a sudden, you are capable of providing services far outside your physical location, which is essential for rural healthcare. Now, being able to take this stuff and implement it is much easier for a smaller hospital system because there's so much less red tape to cut through. So you can reduce your size, increase your nimbleness, and better your output and efficiency and productivity of great ideas. So a small hospital system has the ability to take research, development, do research and development, and put successful products forward right away, very quickly, and provide those products over a wide range of areas. A smaller hospital system that's set up for virtual and specializes, let's say you got a small hospital system that, because they've used technology and their nimbleness, they're just aces of cancer care. They are the best. And a larger system's looking to buy them. I assure you that all the good in that system will transfer to the larger system that may not be geographically in your area, and so those smaller rural hospitals will suffer. But if they're a niche market and they've got this great cancer treatment program, or let's say health and obesity program, guess what? They can spread that worldwide through virtual appointments. Uh, People can go and see them online. They can be provided online guidance for a lot of the care that's out there that doesn't require big, complicated machines. And as for the cancer treatment, if they're really good, they probably already have those big, complicated machines. So they can innovate how patients can come in, get treatment, be secure there, and not have to worry about long drives or long stays. How do you get that out to a rural community where people live an hour away? Okay, we'll build a small hotel here, and we'll have people stay for the intense treatments that they can only get here, and then the ones that take over a long period of time, we're going to send them out to another healthcare system that we partner with, and we are the dominant partner, and we are the ones that are going to guide the treatment because we're so good at it, but we're going to send them to that other healthcare facility. So, and while doing all of this, you can lower labor cost much more effectively because there's a lot less bureaucracies, there's a lot less need for outside labor and additional labor costs, and be just as, or if not more, productive. Um, and as for equipment, you're more likely in a large organization to go to traditional sources for equipment. A smaller organization can look around and find deals and know when to buy used equipment versus new equipment, know when to go on Amazon versus going to a huge medical equipment warehouse that's going to charge you 10 times the amount. Um, there's so much more that you can do to lower cost, increase patient experience, and provide better clinical outcomes faster. Large corporations, not so much. It takes a much longer time. So if you're a small business, stay small. Thanks again for joining me for lunch. I hope you join me back at another time in a future video, and I appreciate your support.